For the past 13 years, my office's PAC unit has been fully funded by HRA and has been charged with investigating and prosecuting high-end welfare criminals. That effort has been so successful that Commissioner Dorr has authorized and will fund an expansion of the PAC unit to investigate and prosecute Medicaid provider criminals. It is a role that draws on my experience as the Medicaid prosecutor when I was appointed in 1975, first as the statewide nursing home investigator, and then thereafter with federal legislation that was created the Medicaid Fraud Control Program, and I became the director for New York State. This afternoon, I'm proud that through the leadership of Senator Schumer and the federal and local authorities present here, that the PAC unit will be expanded to a federally funded new healthcare fraud division, the first of its kind of any prosecutor's office anywhere in the country. And today I'll announce the first case developed through the cooperation of Special Narcotics Prosecutor Brennan and our local and federal partners. A Kings County grand jury has returned a multi-count indictment against Dr. Naveed Ahmad and 26 of his Medicaid and Medicare patients. It is alleged that between 2010 and 2013, Dr. Ahmad wrote hundreds of HIV and AIDS prescriptions for patients whom he knew were not HIV positive or suffering from AIDS. It is alleged that Dr. Ahmad utilized steerers who paid $300 to local residents in East Flatbush who lived near the doctor's office and in nearby shelters, all of whom each had a Medicaid or Medicare card. Our surveillance revealed that by the summer of 2012, the scheme was so well known that recipients lined up around the block from Dr. Ahmad's clinic as early as 7 o'clock in the morning to receive the money, to see the doctor, and then obtain prescriptions from Dr. Ahmad. Our observations further reveal that Dr. Ahmad's waiting room was so full with these fake patients that he had to hire a private security guard for crowd control. For some of these patients, we allege that Dr. Ahmad systemically billed Medicaid each month for the same procedures, such as endoscopies and laryngoscopies, for nearly 10 months. A particularly egregious example was a fake patient who supposedly had 231 nasal endoscopies and laryngoscopies, allegedly performed by Dr. Ahmad over 30 months. And that comes out to 7 procedures every month for 2.5 years. A sample of only 24 of the more 100 fake patients of Dr. Ahmad between 2010 and 2013 revealed that Medicaid paid for over $455,000 of HIV and AIDS medications, which were not medically needed, for patients who were not HIV positive or suffering in any way from AIDS. As our investigation continued, we discovered 90 additional beneficiaries who were working with Dr. Ahmad, who were billed to Medicare between 2010 and 2012. And we are reviewing those billings, which, as far as we can assess, are now about $2 million. As part of the investigation, 2 undercover investigators were sent to Dr. Ahmad's office posing as patients. They requested and received prescriptions for HIV drugs, although we allege that Dr. Ahmad knew that they were not HIV positive. Subsequently, we allege that their Medicaid cards were billed by Dr. Ahmad for medical procedures that they did not receive. For 3 of these bogus visits by our undercovers, Dr. Ahmad billed $5,800.
Open the mouth again. Say Open the mouth. Open. Say
The grand jury has charged Dr. Naveed Ahmad with 20 felonies, including healthcare fraud in the 2nd degree, grand larceny in the 2nd degree, and conspiracy in the 4th degree. If he's convicted, he faces up to 15 years in state prison. I'm particularly grateful to Senator Schumer and his forward thinking that this country needs a cooperative effort between federal and local governments and between district attorneys and United States attorneys. It's his hope that the model that we launched today will have full replication in this country in future years.
The money that could have gone to help people in need is being diverted to people who are lining their pockets. That's bad. District Attorney Hynes has led the fight in that kind of thing for years. We need to do more of that. Senator Schumer, the federal government, we in the city of New York under Mayor Bloomberg are partnering to fight that.
Today, unscrupulous people, such as the person in custody today, seek to exploit the promise of our medical system to line their own pockets and divert to their own illegitimate ends the funds that could go to literally save lives. It is estimated that $60 billion a year is lost to healthcare fraud. How many miracles could that money create?
We look forward to working together and to do something meaningful about prosecuting people who are stealing from the Medicare system and getting a substantial return on the money that was stolen.